What are the advantages and problems of these different system types? Well, the National Health Service is most efficient in regulation of all the functions, all the three functions, regulating, for instance, the budgets, funding, and distribution of services. But that is the other side. They have waiting lists because they don't have enough hospitals, they don't have enough doctors. That's why they have such an efficient regulation. They can keep the money, they don't need to spend more, but then you have waiting lists. And there was a time when Britain was still in the European Union, and they sent patients to France, to the French border on the Channel, towards big cities on the French side, and they had overcapacities. So we did operations for the National Health Services in France. It was like an export. Well, the patients would travel in, would be cared for, operated, and then sent back to Britain, and the hospital sent the bill to the British government. That was very nice. Very good export business. So it seems that technology is diffusing not always very quickly because of budget limits, and the care basket is probably less than what I would have in France, because we have free prescription for the doctors and things like paramedical treatment or massage or rehabilitation, you'd probably get much more in France than in Britain. So all systems, whatever, have coordination problems between primary care and hospital care and chronic care paths, all this organization of something logical, which would be of quality and economic savings, make it a very good procedure that everybody gets the best care without things being missed or double done. Exams shouldn't be double done. You should have all this in sort of informatic systems. All the systems have these problems because there's so many parts in the healthcare system. I tried to talk about this yesterday in the first session. There are different parts of the healthcare system and they don't always collaborate. It's sometimes very difficult. All the systems have these problems, and most of the social health insurance systems, because they are less united than the national health services. Okay, all suffer from some weakness in primary care, all the systems, probably because we don't have enough general practitioners, because all the doctors want to be highly specialized because it gives them better career and more scientific interest. And primary care is the most important thing for the healthcare system because they're on the front line. They can find the illnesses very early. They can have influence about social conditions of healthcare. I don't know, if there's a child who has difficulties, the general practitioner will see it early enough because the mother takes the child along with some cough or something, and then exams show that there are other problems behind. So primary care is really very important, and that everybody should have access to primary care is the most important thing for a good healthcare system. And we start lacking doctors for the primary care in almost all the countries. No choice for patients. It is in theory the least developed in the National Health Service because everything is very much territorialized, and you should go to this place and you have to register with the doctor. And so it's more organized, which has good sides, but it's not always the choice the patient would like to have. The hospital you want to be cared for in, and so on. Choice for patients is much better in social health insurances because they have also been, the government promoted some sort of competition between these health insurance organizations. So they had to lift all these limits, which made people stuck with the same doctor or the same hospital for a long time. It's best in private systems, of course, but then the financial costs would probably limit your choice de facto. So you have a theoretical choice, but not a real one. So in a social health insurance system, choice for patients is sort of fairly good. And prescription freedom for doctors is quite large in social health insurance systems. It's more limited in the national health systems because they are more strongly regulated for economy, for cost control. In theory, it's the largest in private systems, the prescription freedom of doctors, because it's their business. They would like to prescribe a lot. They probably get some return also from the pharmaceutical industry. But profit-seeking limits doctors' and patients' choices. So if the main goal a doctor has in his head or hospital is making some profit out of the patient, then the guarantee that the patient gets the very best treatment for him may be a little bit limited. So this is what we can say about the different systems. Now a question for $1,000. Who is going to answer this question? What is the best healthcare system after we have seen all this? If I was in the classroom, I would ask you to write it on a paper and collect it to see what you will answer. I suppose you don't have much ideas about it, or you would say the most expensive one, but we see that the most expensive system doesn't guarantee you the best life expectancy. So the answer is, it depends really on the data that you collect to judge that or that system is the best. And I will give examples. And it depends on the priority interest of the actors who ask this question. Now, example, in the year 2000, the World Health Organization decided or studied after a long study that France had the best healthcare system in the world. Well, the French people were very much astonished because they think their system is rather disorganized, costs a lot of money, and so on. And some years later, they decided the British system was the best in the world. In continental Europe, not only in France, but also in Germany, everybody knows that there are waiting lists in England and that you have to wait maybe 3 years to get a hip operation. In France, you get this within 3 weeks. So why should Britain be the best healthcare system? And then they decided after COVID that it was Italy. And they had most of the dead people in Europe. So you wonder really how they calculate this. Now, it depends on the data. When the World Health Organization decided France was the best healthcare system, they were interested in those years in waiting lists, how long people have to wait for this operation, for that operation, for cancer treatment, and. And as France had a very developed medicalized system, they had also big capacities, maybe even too big. There were no waiting lists in France. Now we have waiting lists because we have less doctors. A lot of doctors went in retirement, and the generations that follow, they blocked the entrance years ago in the faculties. So the young doctors that are coming are less in numbers than those who are going. But in those days, we had overcapacities and we didn't need to have waiting lists. So France came out, it was because of waiting lists and out-of-pocket payments. As we paid 2 health insurances, we had small out-of-pocket payments. It didn't mean that we didn't pay much. It just meant out-of-pocket payment was little. So we were the champion of the world, the French system. Some years later, they looked into what was the best coordination or the best balance between costs and outcomes in terms of health for the population. I can't remember what it was. Anyway, it was Britain who came out, especially because they limit severely the budgets. So, but it doesn't really mean that the healthcare is always the best when you limit very much the budgets. So, and COVID for Italy, it's in one way it's justified because Italy was the first country in Europe who knew COVID. The first cases were in Italy. It spread when we didn't know yet. And they had enormous numbers of deaths. And they very quickly organized themselves in a very good way and they tackled the problem. But it took a little bit of time in the early. It took 3 or 4 or 5 months. So Italy finally did a good job, but it was a very difficult case, Italy. So maybe they earned some prize here. So, but the French the French record was really not very logical, and the British either. So if somebody asks you what is the best healthcare system, even the World Health Organization can get it wrong. So it's a bad question. There is no good answer to that question. For the following argument, the priority interest of actors will determine what you think is good. Examples. If your goal, now here you have the actors, users, payers, providers, government. Yeah? And here you have the goals, what they are interested in, either in quality or in equity and access or in cost and efficiency. So if you are a user, a patient, you are interested in quality and in access and equity, that you will be treated at least as well as anybody else. So these are your priorities, and you will judge the best healthcare system from this point of view. Where do I get the best quality for my illness to treat it? And will I be treated like any millionaire? Or will I be treated like a little poor lady who can die? So if you are a payer, the one who pays for the care, the health insurance, let's say, you will be interested in only one thing. What is the efficiency of the system and how much care do I get out of the money I pay? So your priority will be here. And this is probably what made Britain come out as a winner in somewhere in the 2000s, probably because of this. If you are a doctor, a provider, a doctor or nurse, you are interested in quality. You want to deliver a good professional work. So you're interested in quality. Maybe you are interested in equal access. It's part of medical ethics, at least in most European countries, that every patient should be treated the same way. So you will be interested in this, and you will judge, like the patients, that this is the most important. If you are the regulator, the government, especially the finance minister, you will have all sorts of priority. You will be interested in cost and efficiency, in equity and access, because otherwise people will not vote for you again. And you want also for this money to get a certain quality of healthcare. So you will probably have a hierarchy of priorities. First will be costs, and second will probably be access and equity, because you are responsible for the country. And third will be probably the medical quality. So if somebody asks you the question, what is the best healthcare system? You'd say, well, your question is very bad. There's no good answer to this question. This is what I wanted to show you. And that's really I will finish with this. The European Union reveals us the conditions for an efficient healthcare system. Efficient meaning offering quality, universal access, and to a reasonable, bearable price for those who have to pay for the care. So why can they offer these conditions? Why can Europe make it visible? But because we have very different healthcare systems, but who share some basic values. And as we have this diversity, and at the same time similarities, we can really look into what produce these healthcare systems, cost-wise, quality-wise, in survival rates, and so on. So the good conditions, we can isolate them very easily from European experience. And we would say the first important condition is to have shared values covering the health needs of all the people. So that means universal access, timely treatment. It's not only enough that you get in, you have to get in at the right time. If you come 6 months late with the cancer or 2 days late with your heart attack, you are dead. So timely treatment. So this is why waiting lists are not a good thing. And equal treatment, including for gender. And I say that for India. So you want women and men to be treated at least equally. The second condition would be to have sufficient collective funding, and I underline collecting, which means money which is brought together according to the means the people have, not according to your health risk. If you collect the money from there according to the health risk, the most ill people will not want to pay because it would be too expensive and they wouldn't get any care. So you don't really have many different ways of organizing a decent healthcare system than what we invented sort of across Europe. with collective funding according to means and distributed according to need. So state capacity is very important, because if you have a healthcare system based on collective funding, you have to collect the taxes or the contributions. So you need an efficient administration. You need a state who knows what the income of people is in order to take these contributions and taxes. If you have mainly an informal economy, where every peasant works on a little land and for his own food and for his neighbors a bit, and a lot of black labor, which is not declared, you cannot collect the contributions and the taxes. So this is one of the problems of the south of Europe. There's a lot of informal economy in these countries. And in one side, it's good that people have this, but it deprives the state of part of the taxes and contributions, and that's the money which would be lacking for the healthcare system. So you need a state capacity which is able to collect the money, and if you have a big formal economy with informal employment, you will have difficulties. You depend on a modern economy where things are formal, where you can then raise the taxes and contributions. Second element of state capacity is that you are able, you have the functionaries and the administrations to implement your regulating of funding, access and quality, and training the professionals that you can do these things. There are countries who don't have the capacities. So competency is important. You need proper and competent management, good technology, good well-trained health workforce. So if you put these 5 conditions together, I think you can see it in a European experience that these are the basic conditions to have a decent healthcare system. And I think I will finish with this for today. I think it's my last. Oh yeah, there's still one to come. First and final condition, first and final. The money that is collected for the healthcare system has to go to the healthcare sector and not anywhere else. That's a very basic condition. So there are 3 deadly enemies for healthcare systems. That's corruption, unduly profits taken away from the healthcare. So healthcare should not be a business for profit making, because this profit is money taken away from the healthcare sector, and it will be lacking. And incompetency. So these are the 3 deadly enemies for a decent healthcare system. And these countries who failed in the eastern parts of the European Union and the former communist countries, there are a few cases who did not succeed in clearing out the corruption, or did not succeed in getting out the unduly profit making, or kept some incompetency in their healthcare system, and then the system is no good. So these are 3 enemies which are clearly identified. I think that's really the end of what I wanted to say today. Well, this is a question for you to think about for tomorrow. Can healthcare be a market? I think I said it all. Just to add, the market is a concept in economic theory. It is very, very clearly identified and theorized what is a market. It means there are equal partners, a seller and a buyer. There's not one who is subordinated to the other. Equal buyer and seller in power and in knowledge. They have the same knowledge about the products or the service they want to exchange. And the price is made by offer and demand. If there's a lot of offer, the price will go down. And if there's a lot of demand, the price will go up. So these are the 3, sort of, an economist may say a little more, but this is basically how the economic theory defines the market. Equal partners, equal knowledge on the products, and price defined by offer and demand. Now, do these conceptual elements apply to medical services? Do we have equal partners with equal knowledge about the product? I mean, about the treatment, that's the service. And is the price negotiated by offer and demand? Surely not. If I see my doctor, he knows, I don't. So there is what we call in sociology a cognitive bias. There's one who knows a lot, who knows all, and I know nothing. I don't know anything about heart attacks. I don't know anything about whatever illness which I may have. but the doctor knows. So the equal knowledge about the treatment is not given. I have to trust the doctor. And the clients are captive. I can't go to any other doctor. Maybe there is not such a specialist, or I'm not able to judge who would be the best specialist. So if I go and see a doctor, I'm sort of, the person will go back and see him again. The patient is captive. It's not a free buyer who can go to the next shop and buy another bottle of beer because the first bottle didn't please him. So this is not. And then we have offer and demand. Now, we say in economy that there's something called price elasticity. If you really want a product, you pay a lot of money for it. Well, I want this house and it costs $1 million, but I want this house, okay? That means this house has a very, very high price elasticity for symbolic reasons or whatever. Now, if I look into the problem of illness, I'm going to die, I have a very bad illness, I'm ready to pay any price to get better. If I'm suffering, have pain, and there's a risk of death, I will sell my house, my car, and take a credit from a bank in order to pay to get better. But this is not the definition of a market where the price is given by offer and demand. It is just because I don't want to suffer, I don't want to die, I'm ready to pay anything. So this is not a normal market. And then we have other things like ethical principles to frame medical intervention. The first one is non-notional. That means don't do any intervention when you are a doctor which can make the things worse. So doctors are generally, a good doctor will be very careful and go there progressively. This is not a market logic. Somebody who sells cars, he wants to sell a lot of cars the same day. He doesn't go there progressively. So it's all completely different from a market. And look at the US example, most expensive healthcare system in the world. In 2019, before COVID, they spent nearly 18%, I said it already, of their GDP for healthcare. And they have a large population without access. And they have medical consumption beyond control. There is this opioid epidemic. People take too much painkillers, and they just die by thousands, and they carry on taking these pills, and nobody is there to stop it. And the same we had with cigarettes. So all this means that healthcare is not really corresponding to what in economic theory we call a market. And if you make it a market, then you have things like the US example. Pay a lot of money for poor results.